Now they can go back to propping their feet up until January. If I had to be a legislator part-time when that really works, that is for sure. That AARP study I mentioned that was just released here a couple of months ago on how people over 60 are viewing themselves and their lifestyles. You might want to compare yourself to this. Steps they take to improve their health in ages 60 to 79. 78% make sure they get restful sleep. 70% maintain a healthy weight. 85% maintain a healthy heart. They think that's important. 67 maintain physical stamina. Now try this one. 44% of people 80 plus perform strength training with weights because they equate muscle strength with mobility and independence. So some things you can internalize and use as you proceed on that others are doing now, that's for sure. Representative Jared Hughes, he joined the governor's office as Senior Policy Advisor on Aging in November of 2020. Prior to that, Jared worked as the project administrator for Colorado's Strategic Action Planning Group on Aging. In his role with the governor's office, he supports the implementation of the SAPCA Action Plan and the Lifelong Colorado Initiative. Jared is also passionate about teaching and inspiring a new generation of young adults to work intergenerationally with and on behalf of older adults. On tape or video file, or whatever they call it now, Mr. Jared Hughes. Watch the screen.
Good morning, everyone. I wish I could be joining you in person today, but I am grateful for the opportunity. Well, this is what happens. Good morning, everyone. I wish I could be joining you in person today, but I am grateful for the opportunity to share some words with you all. For those who know me, you're probably thinking, well, Jared decided to grow a mustache for this. Well, this is what happens when you go see the new Top Gun movie, so don't just go and go to see unintended consequences. The other good thing about making a joke while I'm doing recording is I don't actually know how well it will do in the room, and I don't have to suffer those consequences. For those of you who do not know me, my name is Jarrett Hughes, and I am the Senior Policy Advisor on Aging for Governor Jared Polis. Prior to my time on the governor's policy team, I worked with the Strategic Action Planning Group on Aging. Now in my role with the governor's office, I have the opportunity to lead the implementation of that work through our Lifelong Colorado initiative. I am fortunate enough to have had the opportunity to learn from many of you and work with many of you in the room today. And one of the things that you will hear from me over and over again is the need for us to work closely together across our local, regional, state, and federal levels. I want to talk a little bit about what Lifelong Colorado is and what it means for the state. Lifelong Colorado is the collection of state, regional, and local strategies that will support older Coloradans, their families, and our communities as our demographics continue to shift. It is not one singular thing. It is an umbrella that captures a dynamic set of issue areas, and it works to align and understand their impacts so that we can better develop and implement strategies and avoid doing so in a silo. It includes regional transit planning, local public health assessments, area agency on aging 4-year planning, community comprehensive planning, livable community and age-friendly planning efforts. And then it connects those local and regional efforts into State Department processes, and it connects the dots, creating a feedback loop that works in a top-down path and also a bottom-up path. For the most part, the goals and strategies we seek to operationalize through Lifelong Colorado have been laid out by the Strategic Action Planning Group on Aging. The Lifelong Colorado also is intended to capture the grassroots community-based efforts led by our local leaders. Lifelong Colorado is our statewide vehicle to drive our master plan on aging. Colorado's community-based, localized approach is critical to the overall success of this work. To borrow a term from our broadband and transportation sectors, state government is really the middle mile of this process. We ultimately rely on community partners to be the last mile and drive change in implementation. This is particularly true given Colorado's focus on local control and the important role that local governments play in our lives. This means that we must look beyond the state level if our families and communities are to be truly prepared for our shifting demographics. It's easy to get wrapped up in the General Assembly and the legislative process and what happens under the Gold Dome. But it is equally, if not more, important to focus on what happens at your local or regional housing authority, or your city council, or your local community center. Never forget that each one of us has the ability to impact our communities, and you do not need a legislative process or directive from the governor to do that. Now, this is not an effort to kick the can to local governments and community organizations and wash our hands clean, but it acknowledges an often overlooked component to change. Obviously, state direction and policy impact initiatives and funding, but we must consider all pieces of the puzzle and acknowledge that change and implementation must occur in a vertical way if it is to result in the community impact we all strive for. At its core, Life on Colorado acknowledges this reality and strives to intentionally build a network of local, regional, and state leaders who can help develop more age-friendly, livable communities. As I mentioned a bit ago, it cannot solely be left up to community leaders to carry these efforts forward. Therefore, Life on Colorado and our next steps have intentionally ensured that a demographic lens will be applied across policy domains and departments at the state level. We have intentionally pulled together representatives from our departments of human services, public health and environment, healthcare policy and financing, transportation, local affairs, higher education, and labor and employment to create a technical advisory committee responsible for applying this demographic lens across issue areas and elevating the important work already underway. This includes a focus on our area agencies in aging and adult protective services, public health approaches to dementia prevention, health equity investments that address related social needs, direct care workforce development, long-term care reform, non-emergency medical transportation, affordable housing development and zoning reform, apprenticeship and mentorship opportunity expansion, and broadband deployment and digital equity, access, and inclusion. While doing this, while working horizontally across state government and vertically with our federal, regional, and local partners, we are working across diverse and seemingly disconnected domains. This has been central to the work laid out by the Strategic Action Planning Group on Aging, and it will be carried forward through our next steps at the Colorado Commission on Aging. The importance of intersectionality is key here. To even come close to appropriately addressing lived experience across the lifespan and creating policies that support health equity through increased access to social domains, we must incorporate an intersectional approach at all stages of the policymaking process. An intersectional approach offers the necessary tools to critically assess existing policies and understand the intersection of social domains. Intersectionality encourages policymakers to critically examine established practices and procedures, and it forces us to answer questions such as how policy affects diverse or underserved populations, who is targeted by existing programs and services, how do we increase understanding and awareness of available programs and services, and what inequities and privileges are created by our current policies. These are deeply important questions to ask ourselves if we are to appropriately apply an equity lens and improve health outcomes across the lifespan. Because nothing occurs in a vacuum. And our next steps towards implementation are intended to intentionally address the related but seemingly distinct overlaps that have been historically siloed in policymaking. We have a blueprint for Colorado. We have a complex puzzle that has been laid out by the Strategic Action Planning Group on Aging in our state's master plan. But this plan must be a fluid living document, and that requires revisiting and adjusting over time. We have an excellent foundation to build upon, but we also have some areas that need to be improved and further refined. As we take our next steps with Colorado's Master Plan on Aging and move towards the implementation phase, we will need to set targets, deliverables, and measures along the way that can help us determine what is working and, perhaps even more importantly, what isn't working. We have mapped out the expectations for this process in House Bill 22-1035, modernizing our older Coloradans Act. And it will be an immediate priority for the internal state agency-led Technical Advisory Committee. You know, we all know this, but planning is hard, and implementing is even harder. Systems change doesn't happen overnight, or over weeks, or over months. It takes years. And incrementalism is the belief in change by gradual steps in a strategic and intentional direction. And I believe that that is the path that we must all walk together. Sometimes things will move quickly, other times it will take significantly longer and be characterized by discovering new barriers and difficult failures. But that is the nature of change, that is the nature of policy, and that is how our next steps must work. It's important we manage that expectation, and it's important we keep that in mind as we move forward. Importantly, we must all remember that no one is going to do this work for us. It is all of our responsibilities to be agents of change and drive this work forward, either through engagement with the Colorado Commission on Aging or through specific local and regional efforts. We're very excited about Colorado's participation in the State Plan on Aging Learning Collaborative that will be hosted and supported by the SCAN Foundation, West Health, and the Center for Healthcare Strategies. I know you heard a little bit about that earlier, but this is really a timely opportunity for Colorado to work with these excellent organizations and then also build our network across other states. By building out our network across other states, we create the opportunity to share best practices and learn from one another, bouncing ideas off one another. Given where we are in our lifelong Colorado journey, the timing could not be any better. By creating a group of states that can really come together and share ideas and work together, we create the opportunity to better advocate and coordinate with our federal partners, whether or not that be Housing and Urban Development, the Administration for Community Living, or the Centers for Medicare and Medicaid Services. But we have to remember, we have to be intentional about working vertically and working horizontally at the same time. Lifelong Colorado directs us to reframe the way we think, strategize, collaborate across government and with our federal, regional, and local partners. It changes the way we do business, and it changes our vision for the future and the goals we set out to achieve, so all Coloradans, regardless of age, are able to thrive. We have a tremendous opportunity ahead of us, and we all have a role to play in it. Providers, advocates, private industry, nonprofit leaders, representatives of local and state government. Sometimes these roles may not always be perfectly aligned, and sometimes we will disagree on which puzzle piece to lay down next, how to do it, and where it should go. But we all have to own a piece of this. I'm incredibly proud of what we have accomplished in the 2022 legislative session, and I am optimistic for what comes next. We have a lot of work to do. Let's do it together. Thank you, everyone, and enjoy the rest of the conference, and I look forward to everything that comes next. Take care.